Good morning, Chicago. I'm Dr. Allison Arwady, Commissioner at the Chicago Department of Public Health. Today is Thursday, December 9, 2021. Thank you so much for joining. As always, this is your chance to get your COVID questions answered directly. We've been getting a lot of questions in with the news about Omicron, with our increase in cases locally, and this is your chance to get some of those answered. I'm really pleased to be joined by a special guest today. This is Nick Prashand, who is our Director of Epidemiology at the Chicago Department of Public Health. He's been on before, but has played a long time ago. But he and his team have been absolutely critical for the data that we look at every day, that we share with you, the data dashboard, but also really thinking about how we use data as a health department, how we make it relevant for all of you, how we share it with partners, how we make it more interactive. And he and his team have been thinking about how to take some of the lessons that we've learned from COVID related to data and apply it to a lot of the other health conditions that we monitor and really think about at the city level. And so thank you for being here.
Of course, thanks for having me.
Yeah, and just so folks get a little sense of you and can start putting in some questions that are data related, tell us just a little bit about that last thing that I was bringing up, where obviously COVID has been such an overwhelming thing for the health department in many ways, but particularly on the data side, it's created so many changes. You know, tell folks just a little bit about what that has looked like and how you've been taking it forward.
So people may not believe this, but there's more to health data than just COVID. Yes. So, you know, the health department has been monitoring health conditions and health behaviors around the city for, you know, decades and centuries. So, you know, obviously data has always been an integral part of public health. So, you know, we want to make sure that there are tools and platforms that are available to the public where they can easily access data. So just the same way that we've developed a dashboard for people to easily access data, we want people who are interested in diabetes and child obesity or violence or substance use or mental health, we want to be able to make those kinds of data available to people. So, you know, a large team of epidemiologists across the city work on data every day. And today I'm going to highlight one platform, which is called the Chicago Health Atlas, chicagohealthatlas.org. It's a free website that's available to all residents of Chicago. And on it you will find a whole plethora of data across lots of different conditions, lots of different behaviors, and even including social determinants of health. So we'll talk, and I'll show you a demo as we talk through this. Yes.
Okay, great.
Sure.
So as always, you can put your questions for me or for Nick Prashand in the box below. You can use the hashtag AskDrArwady on Facebook or Twitter. Let's, as always, turn to our COVID dashboard first. You know, just thinking about the data part a little bit, we have seen this dashboard get literally millions of hits, millions of folks looking at this data, using it, and one of my goals is to really make the way that data has been very central, not just to the health department, but I think to our whole response in Chicago. And really, we've seen people know what their numbers are in their community, be interested in how to improve that. It is what we want to take forward. So when we look at the top level of the dashboard here, you do see cases very much on the rise, hospitalizations on the rise, deaths on the rise. This is still predominantly the Delta surge, although as you know, we did detect the first Omicron case here in Chicago, and I expect there to be additional cases in the days to come. We're averaging 948 cases every day right now, and you can see that's up 79% from the prior week. Now, Nick would be the first one to tell you some of that is because in the prior week that was including the 4 days around Thanksgiving, we had a lot of decreased testing and we had decreased case detection, so fewer cases reported. And so you can see actually if you zoom in on this here, we had this drop here in at the time of Thanksgiving, and then it has been very much on the increase. In fact, a number of days in a row with more than 1,000 cases being reported each day in Chicago. So certainly of concern there. Hospitalizations, not surprisingly, are up, currently averaging 55 new Chicagoans being hospitalized each day with COVID, compared to 40 a week ago, and 4 to 5 deaths every day in Chicago. We've had more than 6,250 Chicagoans die from COVID. Vaccinations are also up, which I am pleased to see. We're averaging about 15,000 a day again right now. You can see the little drop with Thanksgiving there, and then that's come up. Testing is up, doing about 28,000 tests a day. And positivity, though, despite testing being up, is also continuing to increase. So again, we think about cases and positivity together. If you are seeing both an increase in tests in cases and an increase in positivity, you know that this is not in any way, we got a number of questions in, isn't this just because there are more people that are testing? No, because if this were just that everybody all of a sudden immediately started testing, your positivity rate would actually drop. It's why we always look at those two together. So we continue to really be in this winter surge. I also just, as you know, you can take a look at what's happening with cases. You can take a look at cases by zip code, testing, vaccines by zip code. I'm not going to take the time today to explore this, but this is where, just to remind you, you can hover over your zip code and see what's happening in terms of vaccination rates. On the cases, you can see what's happening with cases. I'm pointing that out partly because when Nick shows the health atlas, we've taken some lessons from this, and I wanted to just remind you. Anything else you wanted to just say, just high level about the dashboard since you're on?
I think it's been remarkable that the dashboard has, served. I think I'm particularly proud of our department for doing is being able to develop a dashboard that's able to be utilized not only by city leadership but also by academic physicians, infectious disease experts, community stakeholders. It sort of serves lots of constituencies on lots of different levels. So you can use it to get simple data, you can use it to get advanced data. I think that's really kind of what's been really exciting about this dashboard. That it can serve multiple purposes.
Yeah, thank you. And I think, just so you know, I use the same dashboard that we make available to the public every single day. When I want to see, for example, how are we doing on 5 to 11-year-olds? And one of you wrote in with a question about that. Now, more than a quarter, 26.1% of our 5 to 11-year-olds have had a first dose, and already half of those, almost 12%, have had that second dose, and that continues to increase. It is by far the most sophisticated dashboard that we had created to date. And we're really trying to kind of take this again with the Health Atlas. So you can look, sometimes people are writing in wanting to know what's happening over time. All of the historic data is also here related to testing, vaccination. You want to see what daily average doses have looked like by age, right? This green here, that is the 5 to 11-year-olds getting eligible. And the very peak of this was our Protect Your Health on the 12th day, which was the most vaccinating we had done in months and months and months, and really a nice jump start to this. So there's all kinds of detail in here that you can explore. Let me just hit a couple of highlights, and then we'll come back and talk here. So when we put Chicago's data into perspective, we do see that in terms of cases per day, we are back to that very high transmission mark, again, averaging more than 900 cases a day. What is different, some of you were writing in with questions about this too, is that hospitalizations are definitely increasing. But the good news is, do you see how cases are in that red category for very high transmission, whereas the hospital and ICU capacity are still in yellow, that sort of substantial place of concern, and they're increasing. But last year, prior to having a vaccine, generally speaking, when we would see cases go into red, we would also see hospitalizations and even ICU moving toward red. And because where people are vaccinated, they are so much less likely to be hospitalized or to die, we've been really pleased to see that separation. So that's where we are on that. This, again, just reminding you that the pattern that we've seen is what we expected. Last Thanksgiving and last Christmas, we saw similar, some drops in testing, but then some spikes that come with the post-holiday gathering, and it's exactly what we expected to see here. And our positivity, is still in very good control compared to in the past, but it is on the increase. The citywide vaccination rates obviously are available on the dashboard. We also got a question in about, someone asked, why is 5+ at 73.5%, where you just said that 5 to 11-year-olds are only at 26%. I want to be clear, this is anybody who is eligible for a vaccine. So this is anybody in the city of Chicago, age 5 or over. 73.5% of everybody who is eligible has had a first dose. And then 12 plus means anybody who is 12 or up or 18 or up. And then the one that I showed you on the dashboard is the details. So I hope that clarifies that. Here's Omicron continues to spread very quickly. November 26th was the day it was named a new variant of concern. You can see in dark orange here, these are countries where there has been local spread, meaning not just from a traveler. The U.S. is very much included within that. And then across the U.S., these are the states at this point, 22, where it has been detected. The ones where it has not been detected, it is just a matter of time. And some of this is about how strong is the laboratory surveillance in these settings. On Tuesday afternoon, the 27th, December 7th, we did announce the first case of Omicron. I know people saw that in Illinois. We did identify that in a vaccinated Chicagoan and there had been someone visiting from out of state. And was determined to have Omicron out of state. We have a lot of ways to communicate behind the scenes when there is an outbreak of any kind, but particularly when we're tracking a new variant. And so we were alerted to that individual's positive Omicron, the out-of-state individual's positive Omicron, quickly jumped on it, did additional contact tracing and follow-up here. And then where anyone was having symptoms or if there was a positive test, obviously getting these folks not just tested, but getting the sample into the more advanced molecular genomic sequencing that we do as part of RIPPLE, the Regional Innovative Public Health Laboratory that CDPH in partnership with Rush University and then collect samples from across the city, we're able to get that done right here in Chicago. And that's capacity that we did not have prior to COVID. Just very quickly, because we've been getting some questions, I think interest again in case investigation in this setting. So let me just remind you that in case investigation, this is when public health staff are working with someone who's been diagnosed with a disease, in this case COVID. We continue to reach out to every single person diagnosed with COVID-19 where we get a reported test. And if you get tested through a doctor's office, a pharmacy, any of the settings where there's a formal result, we get those and our case investigators reach out. The goal there is to first make sure the patient knows the test results, to make sure there hasn't been dropped. This is where we're having the conversation about who have you been in contact with? Where have you been? Are you vaccinated? What risk factors are there? Who do we need to be concerned about? We're also making sure the patient is connected to medical care at that point, particularly if they develop severe symptoms. We're making sure the patient has support services. Are there needs for isolation or quarantine or food or needing to be out of work that we can support on? And then we make sure that the patient is isolated for those 10 days. So just a reminder, if you are getting a phone call that says it's coming from the city of Chicago, from the CHI contact tracers, or from this number 312-742-6843, pick up the telephone. It might be a CDPH contact tracer. It could be a case investigator. We protect your privacy. We do not share with contacts, with workplaces. The health department is never the one to share your identity. We have ways to protect your identity, but to make sure that we can get the information out to people who need it and limit the spread of disease. We do this all the time for sexually transmitted infections, for HIV, for other, for measles investigations. We obviously do it for COVID, and we're doing it now for this Omicron variant. And then on the contact tracing side, remember, contacts are people who have not been diagnosed with COVID, but have had a higher risk exposure. So particularly if we're talking to a case, that case has not been vaccinated, they're around a lot of people who have not been vaccinated, those would be higher risk contacts. Or if they're around people who are older, those are higher risk. But regardless, again, reaching out, letting people know you may have been exposed to COVID, and making sure they have the information about supplies, right? Are they needing help if there's a need to self-quarantine? What are their questions? Are they connected to testing? Are they connected to medical care? So in the same way, if you get a call that says City of Chicago, 312-742-6843, please do pick up the phone. And then self-quarantine at this point is really primarily for folks who are unvaccinated, as a reminder, but there are a lot of folks still in that category. As variants, and particularly the Omicron, is here, our messaging has not changed. vax up, mask up, back up, wash up, and test up. These are the things that keep us safe, and all of them remain important. I think particularly with the variant, vaxing remains important. Some of you, I'm sure, saw we're getting some preliminary information about the protection that vaccines continue to offer for the Omicron variant. It probably is decreased. We are likely to see more and more of these breakthrough infections, but at least the preliminary information remains suggestive that the vaccines continue to protect quite well against hospitalization and death. More to come on that in the next week or two. But that also booster doses are looking important here. And it is in that setting that we're seeing more and more news about boosters. Testing is also increasingly important, and we've been encouraging people as testing is more and more available to have that. So the vaccine does make you less likely to die or be hospitalized if you catch COVID. That is absolutely true, and it is why we are seeing the surge of cases not match the size of the surge of hospitalizations at this point. All Chicagoans 18 plus should get a booster now. If it's been 6 months after you finished Pfizer or Moderna, or 2 months after you finished J&J. We're still at only about a quarter of Chicagoans 18 plus have done this, and Saturday marks Saturday marks 2 weeks before Christmas. That's your deadline for getting a J&J vaccine if you want to be fully vaccinated in time for Christmas. It's also the time to really try to get a booster buy so that you've had as much protection ahead of the end of the year. Preliminary laboratory studies are showing that 3 doses of Pfizer are helping neutralize the variant. Still learning about this. I will bring you specific data when we have it. We do continue to have vaccine available all over the city, including family vaccine clinics at our city colleges. This weekend, we're at Kennedy King and Olive Harvey, 9 to 2. Walgreens continues to do extra pediatric clinics. And as always, chai.gov/COVIDvax to find out information, or call 312-746-4835 for at-home appointments or anything else. Masking continues to be required in all public indoor settings, regardless of vaccination status. Look for masks that have 2 or more layers of fabric, completely cover your mouth and nose, fit snugly, don't have gaps, have a nose wire, and then certainly people who are wearing the KN95s, etc., have even a higher level. But the most important thing is wearing a mask, and then just staying home if you're sick, waiting on results from a COVID test. And then related to testing, there is low and no cost testing available at local health centers and select pharmacies. Chai.gov/COVID-test will get you there. I will talk in a minute because it's a follow-up in questions about CDPH distribution. And then the Biden administration just announced another $650 million for rapid diagnostic testing, which is excited. The last thing I wanted to note is that health insurance sign-ups are here. So Get Covered Illinois is your opportunity. If you do not have health insurance, you should be seeing whether you can be covered under getcoveredillinois.gov. You can purchase plans there. There are also no-cost plans depending on your income, etc. Open enrollment only goes through January 15, but you've got to enroll by December 15th to have coverage start on January 1st. So you can sign up for a free visit with a patient navigator. They will help you figure out how to get a plan, what costs might be, widget.getcoveredamerica.org, and really encourage folks to do that. And then, as always, this is the number to call. So let's get into your questions, and I want to have Nick have an opportunity to talk a little bit about the Health Atlas. So let me pull up the details here. Oh, we're getting some people already. Somebody says, great to see Nick on Dr. Arwady. He is my hero. So he is one of my heroes too. Thank you for that nice shout out.
Thank you, whoever you are.
Okay, Lisa from Facebook has already a question for you, and this is actually, I think, a good opportunity. So she's asking, she says, I'm a student. I'm interested in looking at different maternal or infant health indicators in Chicago. Is that the kind of thing I can find on the Health Atlas? So I think, great lead-in question for us there, Lisa. And I just want to note, we are planning actually next Thursday to have someone from our Maternal, Infant, Child, and Adolescent Health Bureau be on to talk explicitly about some of that work and how COVID has impacted that. But regardless, so why don't you sort of take Lisa's question? A student, someone interested in thinking about this.
Absolutely. So, vital statistics are one of the main core data sets that the health department uses to understand the health of the city. So naturally, those data from the birth certificates that data that we get are found on the Chicago Health Atlas. So you can see birth outcome data, birth weight data, cesarean delivery data, data across numerous factors related to birth from the birth certificate. So yes, the answer is absolutely yes. It's one of the core health data that we disseminate, and this is this is going like one of the first data sources ever has always been birth outcomes and birth certificate data. It's been super important to understand infant mortality and these things in considering the health of the city. So yes.
All right, so let's take a look.
Sure.
Can we turn the camera back on to show the Health Atlas, and if it's not already there, and then Nick, just talk to people about this.
Okay, so thanks for letting me do this demo today. I think you will find this to be a useful resource. Our goal is to make this sort of the leading source of public health data for the residents of Chicago. We want it to be a platform that can be used by residents who are, not data savvy to folks that are sophisticated data users and medical scientists, et cetera. So we hope that this platform can sort of hit all those different, those different audiences. I want to make sure that people know that there's a way to provide feedback, and we'd love to hear feedback. If you look at the home page and scroll down to the bottom, you'll get this Contact Us section where you can click on this feedback button to write your feedback about new data you want to see, report bugs, etc. And the new feature is we'll have a Chicago Health Atlas newsletter that will be coming out, and you can sign up for that newsletter right here on this site. So let's just kind of dive in here. This is the home page for the Health Atlas.
ChicagoHealthAtlas.org, right?
ChicagoHealthAtlas.org, yes. It's available 24 hours a day. So let's just kind of see what's in here. So let's click on places. It is an atlas, so after all, you want to focus on place-based data. So if you click on places, you can see that you can see data at the community area level, at the zip code level, and at the Healthy Chicago Equity Zone level, which is a sort of a new geographical designation that we're going to be using to do some health planning, for vaccine equity and going beyond that. So, you can take a look at all the different community areas, all the zip codes, and within those geographies, you can also look at the census tract level for many variables, and I'll demonstrate that. If you want to see what's in the atlas, this is to Lisa's question, what's in there. We have 264 indicators currently on the atlas and many more planned to come. But it ranges from areas of clinical care, physical environment, morbidity or illness, social and economic factors. And here's your section on maternal, infant, and child and adolescent health. As just to point that out, health behaviors like drinking, smoking, using substances, physical activity, fruits and vegetable consumption, demography, and then mortality. We can look at mortality from different behavioral health, chronic disease, infectious diseases, injury, violence. And so, I want to dive in here and just go right to the life expectancy indicator. So let's open this up. So this is how the atlas will kind of default to a map view of whatever indicator you're looking at. So, we like to look at life expectancy as sort of the overarching health outcome that sort of takes into account all of the, health factors, social factors, and why people, either live a healthy, long life or not. So you can see a map here that shows at the community area level the differences in life expectancy, and we're not going to dive into specific data values, but just to show you that these features do exist. You can take this data back numerous years. So like this is going back from 2019, going all the way back to 2010, for example. So you can really kind of look at changes over time using maps, using the tables. And so there's a lot of data in here. It's not just the most current data, it's also archived data going back sometimes as far as the year 2000. So just looking across these tabs, we always want to show where the data comes from. So you click on sources and you see that this life expectancy data comes from the Illinois Department of Public Health, thank you, and the the death certificate data files that they share with us on an annual basis. So it's important to understand where the data comes from. We have over 30 different data sources that populate the indicators on the atlas. Most of them are governmental sources, federal, state, local governmental sources. Some of them are CDPH owned data. But we rely on our governmental partners for data sharing and for making this data available to people. So let's just kind of see, going across the tabs, we can go to the table form and look at life expectancy in a tabular form by community area. And here you can do lots of nifty things, like you can rank the community areas. So from lowest life expectancy to highest life expectancy. So 66.3 at the lowest, and then going up to 83.2 in Forest Glen as the highest life expectancy in the city. So you can do.
And that means that people who live in
Fuller Park.
Fuller Park, on average, are living
17
to the age 66.
years less than people in Forest Glen, which is a remarkable disparity. And we've just recently updated this data to 2019, so this may reflect some of the things about Healthy Chicago 2025. And so important data that we use for planning. So you can also look at this table by citywide so that you can see differences by different subgroups like sex, race, ethnicity, and here you can see the racial and ethnic disparity, which we do a lot of our planning around, seeing that non-Hispanic white residents of Chicago live to 80.9 years on average, where non-Hispanic black residents of Chicago live to 71.8 years. So that's over a 9-year gap in life expectancy. So that's one of the central kind of driving forces of our work here at the health department. So it really kind of takes you into opening your eyes to a lot of different equity issues when it comes to health. So then we want to go to the comparisons and trends tab. This is where you can look at comparisons and trends over time. So it'll make this a little bit easier to see here. So you can see life expectancy going back from 2010 to 2019 on this graph here, showing that you do have life expectancy actually decrease over that time period, which is a relatively disturbing sort of trend. So we want to look at, if we want to look at data by bar graphs by different subgroups, if we wanted to compare life expectancy by race, ethnicity in a visual form, you could click on the bar graph and show the data by different race ethnicities. And all these graphics, all these beautiful visualizations are available for download. These download as nice image files that you can pop right into PowerPoint presentations or print out onto flyers, etc. So it really makes it easy to do that. You can also kind of look at this line graph of race ethnicity. So you can follow each of these race ethnicity subgroups, whether you're talking about Hispanic, Asian, Black, non-Hispanic white, or the overall. You can look at the trend over time using this function as well. So let's jump over to another health indicator just to give you a little bit more. So this is the level of high school graduation annually. So you can see over time, Chicago residents, high school graduation has increased from 79% to about 85%, going back from 2006 all the way up to 2019. So that's really good news. So when you look at the map, you can see that there's still a lot of disparities. And when you sort of hover over these different community areas, you can see the different rates appear up in this box. So you can kind of take a look there. So this is where you can really kind of get diverse with the different geographies. So you can look at this high school graduation rate indicator at the zip code level as well, and that shows you interactive as you hover over. And excitingly, you can look at it at the census tract level. And when you talk about census tract is essentially your neighborhood, like where you live. So if you really zoom in here, you can see an average census tract has about 2,000 people, and it's a really hyper-local way of looking at data. And one of the lessons that we've learned from COVID is that people really want hyper-local data to be able to do hyper-local different interventions. So that's something that we really are excited about having available to us. on the Health Atlas. So let's see here. We want to go to, I want to just show you, oops, sorry about that. Let's go back to high school graduation.
Yeah, maybe one more and then we'll.
Yeah. So if you click on a community area, you can actually dive into the place, and then when you look at the map of the community area and you want to look at within a community, we often describe data at the community area level, but if you really take a closer look at a community area level, you really see diversity even within the community area. So this is Greater Grand Crossing at the census tract level, and you can see as these different census tracts have pretty significantly different high school graduation rates. So is this leave it up to our local experts to understand what are those differences and why that's important, and you can really do kind of cool things like take the map and then you can drop pins on the map. So if you're a local interventionist planning something and you want to kind of look and see where you should provide services, etc., you can use these maps to create your own custom views. And of course, this is all printable. You can save these views for later images. So the last function I want to show of the Atlas is the scatter plot function. So we ultimately want to understand how health outcomes relate with the social conditions in which people live. So here, for Dr. Arwadi's satisfaction, I wanted to make sure we covered at least one COVID-related data point. So here is looking at COVID hospitalization rates in 2020 compared to the median household income of each of different community areas, and being able to tell whether this relationship is significant or not. So this is showing you all 77 community areas. Let me just kind of show you here. So as hospitalization rates go up, you can see that median household income goes down. So the areas of the city that have the lowest median household income have among the highest hospitalization rates. So if you click on this map function, it helps you sort of zoom along. You can kind of use it to see where these different community areas are. So it gives you, some guidance in terms of how to actually use this instrument. So these are the features of the Atlas that I think highlight the what you can do with it. There's a lot more. Again, we want to hear your feedback, and I don't want to end the presentation without acknowledging our partners. So the Health Atlas is a collaboration and a partnership between the Chicago Department of Public Health and the UIC School of Public Health and Metopio, a technology startup that has been really great in terms of pushing the ability of public health data and communicating it live. So again, we look forward to your feedback, and we hope that you can take a moment to get on the Atlas and ask questions, and thanks a lot.
Yeah, great, thank you. And I know this is a little bit of a different sort of presentation in terms of having some of this in there, but this is really top of country, maybe top of world, honestly, in terms of this level of data and its accessibility. And my team and all the partners have been doing an amazing amount of work in terms of, we want the last thing we want to do is collect data and not use it. And so we've been working with the state and others. All right, okay, so I'm going to take a couple of these COVID questions, and then we'll come, there's a mix of things in here a little bit. So Alex from Facebook says 16 and 17-year-olds can get boosters now. So just today, actually, as we were walking over here, the U.S. Food and Drug Administration did amend the authorization for Pfizer that allows 16 and 17-year-olds to get a single booster dose if it's been 6 months after receiving their primary vaccine. Now, I want to be clear, the CDC will need to sign off on this, but I expect that will happen. And so this is literally breaking news, and we will be updating our own websites, messaging, et cetera. But yes, I expect that 16 and 17-year-olds will be eligible for boosters, and we will be updating all of the guidance to make that possible. The CDC does technically need to sign off on that. So once that has happened, probably, if I had to guess, later today or tomorrow, that would formally be in place. And just as a reminder, The original Pfizer studies were actually done in age 16 and up. So if you remember, 16 and 17-year-olds were able to get vaccine before 12 to 15-year-olds were, and that is the context in which some of that data and the booster follow-up has been available. So that's why that is. And you know, and some more questions here just about why are there more. Why are we pushing on boosters? Because there has been this preliminary information, especially with Omicron, that building those antibody levels back up is probably increasingly important, and that's why we're trying to get ahead of this and have people, because we do have availability, get boosters now. Okay. Beth Blackson on Facebook says, thank you for the detailed tutorial. Post the link to the session widely. All public health students, advocates, and stakeholders should check it out. Thank you, Beth.
Can I add something to that?
Please do.
So we are planning a series of video tutorials that are being produced by the USC School of Public Health, and so just stay tuned for those. This whole tool is in development, so we expect changes as time goes by. So thanks.
Lisbeth Tavermina on Facebook says, please reassure us again that immunity is dependent on vaccines and their subsequent boosters. Can you assure us again we have enough syringes in stock for boosting and reboosting us into the next decade if necessary? So, Lisbeth, we are absolutely prepared in terms of syringes, in terms of vaccine, in terms of the way to do this. You know, I am hoping that this is not something that we are boosting and boosting and boosting forever and ever, but certainly the vaccine remains the most important thing. That's why when I give the vax up, mask up, et cetera, we start with vax up. It is why we are seeing, I am concerned about increases in hospitalization, for sure. We start to see the hospitals get into trouble. That's the setting in which we have to be even more aggressive. But the vaccine is part of what is increasingly turning this disease, you know, into something that is not life-threatening. And, you know, that's part of why it's really important. But yes, vaccines and their boosters are the #1 key to this, and we absolutely, honest to God, the preparedness team, the immunization team at the health department, second to none. You know, I often give them call outs here, but the fact that we are the only, still to my knowledge, the only jurisdiction that actually had the immunization practices in place and the storage and the cold and the security and all the things that you need that let us return unused vaccines so it could be sent internationally. It's something I care about a lot when we talk about vaccine equity at the international level, but it also really is a testament to the extremely hard work and long-term, many-year investments that we have made as a city in that front. Okay. So Kristen Korkowski on Facebook says, how will Omicron affect someone who is Pfizer boosted? There was a breakthrough case with the Pfizer booster. I have the Pfizer booster and I'm highly concerned. Yes, Kristen. So this is exactly why we are doubling down on sort of, you know, working to make sure that people can be vaccinated and boosted. The vaccine, you know, has never been 100% protective. We should have some more specific numbers for you within probably a week or two related to what are the different protection levels. Clearly, the vaccine continues to show protection against Omicron. It is probably not as high as the protection against the other variants. And for me, the biggest question actually is how much that booster is fitting in. We are seeing some breakthroughs, including in people who have been boosted. We are not seeing severe outcomes in those folks at this point, which is critical. So I certainly share, I am someone who has had both Pfizer vaccines and a Pfizer booster. I have not changed my practices at this point, but I am someone who all along, of course, has been careful. I only go to fully vaccinated settings if it's a setting where I, you know, may have to take a mask off, et cetera, or if I'm gathering. And I have been careful with all of the other metrics. So we will keep you posted, but if you have gotten boosted and you're otherwise doing the things that help add levels of protection to that, you have done the things that are the most important. And I have not not stopped going out and doing things in Chicago. I've been out to some of the lovely holiday events that are getting going. And, you know, at some level, we are needing to, we're not going to eradicate COVID. You've heard me say that over and over again, unless there's some major breakthrough. But where people are fully vaccinated and boosted, my concern for serious illness based on the data at this point is really quite low, which is good news, but we're still learning. Okay. So Jackie Pine Rodriguez on Facebook. When do we expect children younger than 5 to get a vaccine? I anticipate that this will likely be in the first quarter of 2022. We've not gotten additional information, you know, from the companies or from the FDA or the CDC yet, but that would be my guess. I do think if there is a decision that there needs to be, you know, a booster, you know, there's additional work that needs to be done related to Omicron and vaccine, could that adjust that timeline? Could there be a decision to actually, you know, for Pfizer is one of the mRNA vaccines that there can be adjustments made if that's needed. Could there be a decision to do that for the younger children? It's possible. But at this point, I expect children under 5, probably in that 2 to 4, if I had to take a guess, likely first quarter of 2022. So we're getting close. Rock Giovanni from Facebook says, what's worse, COVID or the daily slaughter in Chicago? COVID is the biggest scam in history. So a lot of you have been writing in saying, it's been interesting to see this uptick in people saying that COVID is a scam, that somebody wrote yesterday and said nobody has actually died from COVID. I am not sure, you know, how to counter that level of disbelief in facts. If you are lucky enough to not personally know somebody who has died from COVID, you are unlike most Americans. I'm just going to be honest. And, you know, I presume by quote unquote daily slaughter in Chicago, you're talking about people who die related to violence. Of course, we are concerned about the increased homicide rate. And that has been seen all over the country. There are probably indirect ways in which COVID fits in there. But do I have a vaccine for violence? I do not. Are the numbers from COVID deaths more than the number of people who have died from violence? Unfortunately, yes, by large factors. In the same way that people are writing in about, you know, this is just like flu. Are the numbers, you know, we have thousands, you know, Nick, you can add in on some numbers here. You know, we've had 6,200 plus Chicagoans die from COVID. Over that time period, a handful of people die from influenza. Even in a bad influenza year, we're talking, what, a few hundred probably, yes. Typically? Here in Chicago, people die from COVID, not thousands. And so I am not really about what is worse from a public health perspective. All of these are issues that need addressing. It's why we encourage flu shots. It's why we've been working on really building the public health approach to violence prevention that I think is critical. And I've been really pleased under Mayor Lightfoot with the Chicago Police Department, thinking about new ways to do violence prevention that are about these root causes. There's a lot on the atlas that Nick was showing that relates to this. We've been doing a lot in the substance use space. There are a lot of deaths in Chicago, and some of those are preventable. It is our job as a health department to work on all of those. But let me just be extremely clear that COVID is not a scam. COVID is not the same as the flu. There are not the same number of people dying from anything else in Chicago compared to that have been dying from COVID. An average of more than 10 a day right here in our city dying each day from COVID if you average that over the whole pandemic. And almost 99% of those deaths, people who are not vaccinated. So if I had a vaccine for violence that cut it like that, of course we'd be using it. And we are using lessons from COVID to work on violence prevention and response and substance use and some of these other issues, just like we are data. But I would really encourage anybody who thinks that COVID is still a scam to just start talking about that to people around you. And right away here in Chicago, I would say within the first 5 people you talk to, you will talk to somebody who personally knows someone who has died from COVID. At least that has been my experience, and I talk to people here in Chicago about this every day. All right, the question for you, Nick.
Sure.
So someone is writing in, I live in Montclair, 60707. When I look up our vaccination rate on the dashboard, it says not applicable. Why is that? I know there's a larger issue here related to some of those border zip codes. So can you maybe just address some of that, just high level?
Sure. So Montclair is a border zip code, and there are issues with the way that we get our data from the state of Illinois, and there's issues on the way the state reports vaccinations for people in different jurisdictions. So you may live in 60707, but not live in the city of Chicago. So if we report the Chicago rates of vaccination, they tend to be very they tend to be underestimates of what the true rate is. So, I know that our immunization and epidemiology teams are working with the state on sort of resolving those issues. That's not the only zip code that has that issue. There's a zip code on the far south side that also has the same issues as well. So, these are perennial data problems that, again, it says to me that the enthusiasm for data is so high that, this has been the same problem reporting any disease across the city at any time, but nobody's ever really noticed until now. So that's great. It keeps us on our toes. It keeps us improving our data. So, keep giving us that feedback, and, we will work to address it.
Yeah, and we actually are working with the state and county partners, et cetera, on making sure that data can be shared in ways that continue to protect privacy, which we are absolutely committed to, but that let us make sure that we can understand what's happening, not always being drawn at these sort of false jurisdiction lines. And, there are some legal things that need to be addressed in that, but I am not interested in data that is not accessible to the public and is not being used. And I believe strongly that it is incumbent on us as a health department and on any government agency that is working to collect data to make it available and to make sure it's being used, and that we adjust our approaches based on it. It's what we've done well during COVID, and it's what we want to do moving forward. Okay, so let me just hit a couple other of these relatively quickly. So Lee Mabry White on Facebook said, is social distancing when possible still safe in Chicago public schools? So not just Chicago public schools, but schools across the city continue to, by and large, not be places of COVID spread. The rates have been lower for kids in school than out of school. And in fact, there will be some additional data coming out probably nationally that's been looking at, for example, when we do quarantine children after they've had an exposure at school, how likely is it they develop COVID? Here in Chicago, with Chicago public schools, it's been like 1% to 2%. 98, 99% of the children who we actually quarantine because there is an expected, social distancing was perhaps not possible. Very few go on to develop COVID. And so, yes, I absolutely do believe that there are, yes, that the schools, we are working very, very hard to make sure children can continue to learn in safe environments. I see your interesting comment, follow-up here, Lee, says, I don't think people think COVID is real because we have more cases this year and there are far fewer mitigations. It's a bit of mental gymnastics. Yeah, there are a lot of, I know that everybody is very tired of COVID, okay? Nobody is more tired of COVID than the people who work at the Chicago Department of Public Health. But we have not dropped for 1 minute our work on this. And the case investigators and contact tracers, and I've got a question on that and I'll hit it in 1 second. The case investigators and contact tracers in particular are the people calling up Chicagoans every single day who have just been diagnosed with COVID. And that is very hard work. There can be a lot of questions. There can be sometimes guilt for people. When people are vaccinated, they feel like I've done everything, why is this happening? We do not always have all of the answers, but what I do know is the science is slam dunk in terms of vaccines being the most important thing in terms of helping protect individuals, families, the city, and that the other mitigation measures that we've had in place certainly have worked. So yeah, thanks for the comment there. Aaron Sanders on Facebook says, how long would one expect to wait before being contacted by contact tracers? I'm up to 4 people I know who weren't contacted going back to July who had breakthrough cases. Also, who exactly is testing for variants? Okay, good question. Those are 2 different things. So first of all, the case investigation is the part where we are reaching out to people who are diagnosed with COVID. And depending on the time frame here, when we were in the very, very big surge last November, December, when we were having as many as 3,000 cases diagnosed a day here in the city of Chicago, there was a point where we were having trouble keeping up with timely contact tracing. But that was for a very short time period, and we are absolutely reaching out more often, and we have a protocol where if somebody doesn't pick up, we call again, more often. And I know this because I've seen the exact data from my team. It is because people don't recognize a number or aren't picking up a telephone. And we do leave voice messages. We do work. But it's got to be a Chicago resident. That's the other thing. So I don't know whether, Aaron, you live in the city of Chicago or these folks do. Every local health department does its own calling. We know best how to get people connected to a doctor if they don't have one, what the resources are available if they're needing assistance, understand the spaces where people are having it. So again, if you get a phone call that comes, I've encouraged people to just put this in their phone, save it, like 312-742-6843. That's us. And it also, in many of we've worked to have it come up as looking like City of Chicago or CHI contact tracing, but it depends a little bit on your carrier. And I know a lot of people have mobile phones. So, yeah, we do absolutely reach out to everybody. And if you are a Chicago resident, nobody's reached out to you, you're concerned about it, you can also call us, right? Like, that's not a problem. Like, you can always just call the vaccine number, we'll figure it out. But we do, we have the staffing, and we absolutely continue to do this really for everybody. And then just quickly on the second part, who exactly is testing for variants? So when you get a test, or anybody gets a test, you just get a positive or a negative, right? We've talked about this. And there is an extra level that happens for public health purposes to understand, are we seeing variants? What does that look like? And here in Chicago, there's a number of ways that happens. CDPH has invested millions of new dollars in federal funding to build up the capacity to do that variant work, that sequencing work. We did a request for proposals. Rush University Medical Center won as our primary lab partner there. So a lot of the actual testing is happening at Rush, but samples get collected from all over the city, from maybe smaller hospitals that may not have the genomic sequencing, from other settings, when we're investigating outbreaks, when we're looking at breakthrough cases, anything that is sort of for public health purposes, we're wanting to understand, could this be a variant? Is there something going on? We now have the ability to do that testing at a larger scale, much more quickly. We doubled the number of samples that are being collected with Omicron. And in fact, that first Chicago case was detected through RIPPLE, we call it, the Regional Innovative Public Health Lab at Rush, as a result of those investments. In addition, there is this work happens across the state, and there are other, especially some of the academic, larger medical partners. Northwestern does a lot of sequencing. No matter where a virus is sequenced, in Chicago, in the US, in the world, it actually all gets uploaded into a single database so that we can share and understand how the virus continues to mutate. So that's how we do it, and there's a lot more information if you want to go to the CDPH website to follow up on that. Last quick question. Duke D. Brown on Facebook says, how soon can I get a booster? I had breakthrough COVID after I had been vaccinated. Yeah, good question, Duke, and I get this one a lot. You do not need to wait to get a booster. If you get breakthrough COVID. You need to wait the 10 days during the time that you need to isolate, whether or not you've been vaccinated. If you do get diagnosed with COVID with a breakthrough case, you have to isolate for those 10 days, et cetera. Obviously, the chances are, you are unlikely to get seriously ill, which is a good thing, but you have to do that isolation. You shouldn't get it in the first 10 days. After that, you can get a booster. And I have been encouraging people just in this current surge, et cetera, to go ahead and do that. The chances are good that in the 3 months after being diagnosed with COVID, even if it's a breakthrough, those first 3 months, you're very unlikely to get reinfected again. That natural protection, quote unquote, is quite good for those first 3 months. And so early on, we were encouraging people to sort of wait the 3 months, partly because we didn't have enough vaccine. We have enough vaccine, and I would encourage people, and folks among my own staff, where we've had a few breakthrough cases, and they are happening more in people who have not been boosted, we've been encouraging them to just go ahead and get a booster. So good questions. Thank you again. Nick Prashand is our Director of Epidemiology at the Chicago Department of Public Health. He and his team have done just amazing work on all things related to COVID data. A lot of the innovative things we've done here in the response have been based on some new and very nimble approaches. It's a major area of investment for us. And the Chicago Health Atlas, again, at chicagohealthatlas.org, in partnership with UIC, is the large sort of where we're going next. And boy, would I love feedback on that. So please, if you're someone who's been following along with us all along and looking at the data, do take a look at the Health Atlas, because we are going to continue to develop it. And we want to make this about, not just looking at data, admiring problems, but using this data. And we want partners to use this data. I think data is one of the best ways to actually consolidate action and make sure that we are aligned and not stepping on each other when people are trying to work on different issues. And it's one of the things that is just critical to our long-term work as a health department. So anything last you wanted to add, or you didn't have a chance to fit in?
No, I think I got everything. I mean, I really hope people are using the Atlas, and I think the connections people have made from COVID to other, ways of looking at data in the city. So, trying to understand poverty and its connection to COVID, employment patterns, all those things, the Health Atlas, I believe, can help us understand.
Yep, and that's what we're doing. So thank you again for tuning in. Just as a reminder, there was a question, how often do you do this? We do this Tuesdays and Thursdays at 11 a.m. Central. And we pretty much do it every Tuesday and Thursday. We've been bringing guests more often on Thursdays. Yeah, I'm sort of committed as long as this is going on and we continue to get the volume of questions that we get in. I really appreciate hearing what people are thinking about and worrying about. It helps us think about our messaging. Thank you to those of you who continue to talk about COVID and particularly the importance of vaccinating. We'll keep you posted. We're doing everything we can to keep the city safe. And thanks so much again for tuning in. Bye-bye.
Thanks for the opportunity.
Of course.